Listen, it's Community Health Ambassadors Nathan and Andrew. Welcome to the show.
Hi. Hello, thanks for having us.
Right, so we're going to have a little chat about what you guys do and everything. First of all, that's not got nothing to do with anything, just to be friendly. How are you?
I'm good, thanks. How are you?
I'm good. Andrew, you've just been telling me you come back from Austria and Germany.
Yes, a nice week away in Austria and Germany. Very nice.
What was all that about then? Just a bit of leisure time, as the Americans say.
It was my first wedding anniversary, so nice. Pleasant to my wife.
Fantastic. Well, many celebrations, what do you say? I forgot.
I thought you were going to say commiseration.
No. Well done. It's good to be married, especially these days, isn't it? Not many people do, so that's fantastic. Right, anyway, let's cut to the chase anyway. You are the Community Health Ambassadors. Can you just explain to me what's that all about?
Yeah, do you want to go?
Yeah, certainly. The Community Health Ambassadors basically is a programme that's been kind of funded by Hartlepool and Stockton-on-Tees Clinical Commissioning Group.
Right.
We're responsible for kind of buy-in services, health services throughout Hartlepool and Stockton-on-Tees.
What kind of services?
So if you end up in A&E,
all right,
we will pay for that. So
you'll pay for it?
Yeah, we pay for their kind of, and we commission the service.
I thought the National Health paid for it.
We do, but so National Health is split into what's called commissioners and providers.
All right.
So if you end up in North Tees Hospital, as most people well from around here, is kind of
stacks of times.
That's kind of the trust. They're the provider of the services. We as a CCG are responsible for ensuring that they're there, so you're able to go and access those services.
Wow, all right, so you actually pay for parts of that?
So we commission the services to make sure they're there, so we commission the mental health services, for example, maternity services. We've only recently become the commissioners for GP services in Hartlepool and Stockton-on-Tees, so ensuring you've got access to your GP. And basically what Community Health Ambassadors is about is trying to get the engagement from the public, and basically to help us understand where our health services are needed and what's required, and if they're actually delivering what the public needs.
And it's all kind of health services, mental, A&E, all kinds of things.
It's everything. I mean, there's different bits responsible for commissioning different bits, but about 95% of it is our responsibility. So we're kind of the people who we want to...
So it sounds like you're a government thing then.
We're part of the public sector.
Yeah.
We're actually a statutory organisation in our own right, which isn't exactly a very interesting thing, but it's
right.
And basically, what we do is kind of work together with our providers to ensure that the services that everyone uses on a daily basis are there and are provided. Right.
A lot of people are whinging these days, aren't they? Like the services are a bit kind of full to kind of bursting at the seams. What do you think about that?
I think it's a legitimate concern that people have in terms of kind of the availability of staff and services. I mean, we are at the minute going through something which is called a Better Health Programme. Right.
Is that a nationwide, or is it just...
It's across Durham, Darlington and Tees, and we're looking at the way services are actually configured.
I mean, I would imagine, I've lived in London in the past, a lot of years ago, but I lived there for 10 years, and any time I used the NHS there, for example, hospitals and things like that, I was waiting about 3 times more than here. Up here, it's like a luxury compared to down there. And I suppose it was just because of a simple thing as a numbers game. There's not that many people in Teesside, really, for the services that we have, I don't think.
No, I mean, in terms of the area we're looking at, so Durham, Darlington and Tees is about 1.2 million population. So it's
more than I thought.
It's bigger than I think people think. That's all the way from kind of Chesley Street.
That's a big catchment area.
All the way down to Middlesbrough, Redcar and Cleveland,
Yeah.
So we're talking about quite a large geographical area.
Very big. And you're in charge of, well, not in charge, but you commission kind of all of that area?
No, we commission just for Hartlepool and Stockton.
Oh, just for Hartlepool and Stockton.
So there's Hartlepool and Stockton-on-Tees Clinical Commissioning Group, there's Darlington Clinical Commissioning Group in this area, North Durham, D-Days, which is Durham, Dales, Easton and Sedgefield.
Right.
Try saying that.
Sounds a bit like Farmer Giles kind of territory, yeah?
And South Tees as well, which is Middlesbrough and Redcar and Cleveland.
So you're a busy man?
We are.
You both are. And what do you go out then? Do you just go out like liaising with different groups and stuff that are
Yeah, so...
if you can just get a bit closer to the mic, boys. Pull your chair in a bit. Don't be shy. Just so you come up nice and crisp on the thing. Yeah, that's perfect.
So I work for an organisation called Catalyst, and
Yeah.
I kind of work in partnership with Andrew from the CCG, as you mentioned.
Right.
We actually run the Community Health Ambassadors programme in kind of partnership with Andrew.
Right.
And the idea is basically engaging with people from the community to make sure that a range of patients' voices are heard, but it's all about engaging people who are kind of not often heard or underrepresented or particularly disadvantaged groups to make sure that their experiences and needs to access health services are kind of heard and then responded
And all
to.
kinds of health services, mental health and all other
Everything,
kinds of health, yeah.
GPs, walk-in centres, as you mentioned, ambulance services,
Yeah.
everything, more than 90% of the services, as you mentioned.
What about the poor people, the refugees that we've had a lot lately and they can't speak such good English? Do you help with them and stuff?
We do. We
Yeah.
commission an asylum seekers practice
Brilliant.
here in Stockton.
Because they need all the help they can get, don't they?
And they do.
I wish a lot of people would think, when this European referendum thing was on, I mean, I'm not interested what people voted. I voted Remain, yeah? But what really peeved me off a little bit was when I just heard people, too many immigrants kind of thing, without really getting the real picture. Without really, what about the empathy? Like, these people have actually left horrific, hell on earth kind of places, risked their lives just to get here because it was that bad where they were. You know what I mean? Instead of people saying, there's too many people, they should think about the poor people that had come here. They didn't want to, but they had no bloody choice. You know what I mean? And I wish people could get the facts right between what's an immigrant and what's a refugee. People don't seem to realise what the distinction is.
Yeah,
it's massive.
I think in terms of the service that we do, it's specifically for asylum seekers.
Right, yeah.
So they're people who are fleeing.
Yeah, they're not immigrants.
No,
they're here because they've had to save their own lives.
They're very much not.
Because they've come from hell.
Exactly, and that's kind of asylum seekers. But
Yeah.
You're right, and I mean, we did some public engagement in May, and one of the first questions that was asked to me on my table was, is it the number of immigrants that's causing an increase on the NHS services and a demand? And my response for that was, for the North East, is quite simply no.
No, right,
it's not.
there you go.
It's the reason that kind of demand's increasing for health services is people are living longer.
Yeah.
People have...
And I must admit, people are living longer, and I also think they're living longer due to, I don't know, well, just the quality of life is better than it was 50 years ago, isn't it? But they're living worse. They're living longer, but they're living worse.
Yeah, that's exactly
with the food habits and things like that.
And lots of people are living with multiple conditions as well.
Multiple
you've got
conditions.
Lots of people who are living with kind of diabetes from type 2 diabetes from kind of 50, 55 onwards. And
I know.
there's a lot
that didn't happen in my granddad's generation. You didn't get people with the diabetes at that age. You know why? Because they were eating real food. I'm not slagging people off here, by the way. I'm known to like my sweet things now and again.
Right.
But I have to be careful, and I do a bit of exercise. People on a mass scale getting diabetes, and they're like, well, even earlier than 50s. It's not right. It's a public bloody outcry. It's a health scare, if you ask me.
And I think the other thing that we've got is actually is a lot of kind of makeover from our industry, our heavy industry. So we've got a lot of chronic obstructive pulmonary disorder.
Really?
Which is basically breathing difficulties because we were a heavy manufacturing industry area.
Oh, right.
A lot of
that's to do with it as well, yeah.
A lot of kind of steel works, kind of mine works, and a lot of that is...
Yeah. I tend to think, a lot of it, I think, right, I wish they'd push more. I mean, that Jamie Oliver gets right on my nerves. Mr. Bloody Perfect. I'd show him a thing or two if he come in here, I'll tell you. But at least he tries to get people to eat healthier. But I think a lot to do with it is exactly that point. I think diet's a massive thing,
I agree, and I think what we by doing this kind of community health ambassadors as well is what we encourage is kind of healthy messages as well.
Yeah.
So that kind of taking that message out there about what we're trying to promote in terms of kind of cancer awareness months and that kind of thing.
There seems to be more cancer now than ever, but is it because we're just more aware of it, I think, isn't it?
I think because we're actually able to detect it
exactly,
much quicker.
Yeah. Before people just got ill and they died, and that's what people did, didn't they? Now we know why.
I genuinely think we were able to detect it. The NHS is set up to meet targets to 2-week waits for cancer.
But a lot of it, mate, is in the actual education. If you walk down Stockton High Street, right, in like an hour and 10 minutes, right, the more shops that you'll see the big queues out of, food shops, I mean. Greg's, there'll be people doing a barn dance outside almost. Do you know what I mean? It's so popular. I travel a lot, right? When you go to any airport, right, you walk through the airport doors, the first thing you see is a bloody Greg's. What's all that about? Greg's is rubbish food. I like a nice cheese and onion pasty now and again, but you can't live on that junk. Do you know what I mean? It's just pure pastry that blocks up your arteries. Why do people eat it all day, every day?
Having just come back from Austria and Germany,
What were they eating there?
All I've seen is sausage.
Maybe that's not that much better, but if it's good quality meat.
Yeah.
If it's good quality meat. But getting back to the important thing, so we've covered diet and all that. You cover everything that's to do with health.
I mean, and one of the things that we kind of wanted to come to talk about this week as well is it's Health Information Week.
Yeah. Right, is it really? Right.
Yeah, so we're trying to kind of spread the kind of word about the fact that if you want health information, if you need it, we can provide lots of information on screening, cancer awareness, public health issues.
Hey, so listen up, everybody. This is the Community Health Ambassadors, and how would we get in touch with you guys? Advertise yourselves over the air.
So we're based at Catalyst, and you can catch us on 01642 733 906, and my name's Nathan.
Right, I'll just repeat that. Say again, Nathan. That's
01642
Yeah.
733
Yeah.
906.
Right, so you've got that, everybody, and that's Nathan.
Yeah. And we run the Community Health Ambassadors program. We're always looking for volunteers if anyone's interested, and we're always quite keen to say there isn't really a strict time commitment, so it's,
all right.
We usually have kind of a quick catch up with people when they are interested.
And what would these volunteers be doing? What would be a typical kind of day?
So we've got about 20 volunteers across Hartlepool and Stockton at the moment, and they all kind of do take on the role in different ways, really, just depending on what they're already doing within the community, for example. So,
right.
It's just about making most of the conversations of people you're already in contact with, really, or contacts you have, or a lot of people work with groups already, and they'll engage them around their particular access or experience to health.
Fantastic.
And make sure that we can try and improve the way they access services, because they're already working with people who are kind of happy to talk to them about kind of sensitive issues, if you like. But we've got feedback systems in place. It's quite positive, focused, if you like. So it's not a complaints procedure as such. It's kind of saying, I had this experience, it would have been better if GP practices.
Oh, so you're all about trying to help make things better as well, not just accessing the services,
so
improving them.
It's a total range of things. So access
sounds great.
Community to GP practices, making sure.
And do you actually liaise with these GPs and these health workers and things like that?
So the clinical commissioning group's actually made up of GPs.
Oh,
so
right.
The GPs are actually the commissioners and we're the kind of staff that work on behalf of them. So essentially, we can get the message straight through to kind of GPs and give them the information about actually to improve services.
Brilliant.
We can consider this, we can consider that. I mean, one of the examples that we've used and we've done was, it was pointed out to us that via the kind of someone in the deaf community, that there was no translators, no sign language available for an appointment they were at.
Right, yeah.
And actually, our providers are mandated to do that.
Yeah, yeah.
So we actually took that back to them and said, why? And asked the question.
Why wasn't there anybody available?
Exactly.
Yeah.
And admittedly, it has happened again, but if we keep up the pressure, we can try and make sure that actually people are able to access their appointments, because there's nothing worse than turning up and then not being able to communicate.
No, of course. They're probably going to be worried or anything. Nobody likes going to the doctors, do they? And if you can't get your message across. Exactly, yeah. Brilliant. So it sounds like a great thing you do, and I didn't realise it was such a wide, complex area that you did, actually. I just thought you were a little organisation, but you're massive, aren't you? Yeah. You're more like of a tentacle kind of.
It's just a range, really. We work kind of with a range of volunteers for them to give us their thoughts.
So do you two work together a lot then? Are you all?
Yeah,
brilliant,
so,
brilliant.
But I think from our point of view, kind of working with the volunteers, and quite a new relationship with Andrew from the CCG.
Yeah.
We've done kind of community activity in the past, and with this particular project, if you like, it does seem quite genuine. It doesn't seem like a tokenistic public engagement effort. It seems genuine, like
people
we
need
to make sure the public's needs are met while we're commissioning
Well,
services. This is the best way to kind of make sure their thoughts are heard, if you like. So we're kind of trying to encourage people to engage with it as kind of like, this will make a difference, and I think it's a topic that people are quite opinionated about, and they'll happily
let's face it,
talk to their friends and say, oh, I went to the hospital and this happened.
What's more important than health, really? And the sign of a good society is a society that's got a good healthcare system, isn't it? I mean, look at us compared to America, where they don't even have a national health.
Yeah, exactly.
You know what I mean? Our national health's been a bit rollicking these last few years, but I still think it's one of the best things we've got in this country.
I agree wholeheartedly.
Let's just hope it stays that way.
Yep.
Let's hope people like Nigel Farage aren't lying gits, and maybe they do put some more money into it. Hey, that's really fantastic. You've really opened up my eyes to that. I was expecting a completely different thing. Is there any more else you'd like to put forward as you're getting listened to and stuff?
We're actually doing a survey at the moment, which will close at the end of this month.
All right.
Particularly around health services. So it's completely anonymous, and we've had over about 215 responses at the moment.
Right.
So, that's available online, and we've also got hard copies at a couple of events, which I'll talk about in a minute.
So what's the web address for that survey?
It's just on SurveyMonkey, but it can be found on the Catalyst website.
Right, and Catalyst is, what's the Catalyst address again?
It's catalyststockton.org.uk.
Yeah, I think it is. Yeah. So everybody, can you just say that again, please?
Yeah, so it's www.catalyststockton.org.uk.
So listen, you can get your information regarding this healthcare survey on that. People, get it, do it, because the more people who fill it in, the more you guys can do your work, isn't it?
Yeah, and I know Andrew's already kind of said they're kind of willing to take their findings, if you like, to their governing body, so it will be heard by the senior.
Oh, fantastic,
body,
fantastic!
Like, around what the residents of our community are saying, they want health services to be. And there's a range of things there: GP services, hospitals.
Are they still going to be making that big mega hospital now in the outskirts of Billingham, or is that getting ditched now, or are they just keeping the actual North Tees one in Stockton?
I think the official line from the provider, which is North Tees and Hartlepool Foundation Trust, is that it's currently paused.
All right, on pause, yeah.
So I think that's the situation it is in a minute. But as part of the Better Health programme, which I talked about earlier, we're actually looking at the way services are provided right across the region. Actually, that'll be part of the consideration when we kind of come to talk about that. And we're doing engagement work July the 13th at North Shore Academy.
Oh, right, which is that in Tyler, isn't it? That new big academy school,
6 till 8, for people to come along and actually talk to us.
Kids as well?
Anyone can come along. It's 13th of July, 6 till 8, and that's the Better Health programme.
Oh, right, brilliant. So, and again, anybody interested can just nip along to that?
Yep.
Fantastic. Will you be there to answer questions and stuff?
I certainly will be.
Brilliant.
I'm always
on your soapbox, yeah? Do you travel around quite a lot then with your job? You must be always out and about, on the move, are you?
Mostly, yeah. I mean, I think
keeps you busy though, eh?
It does. You can't complain about being busy.
A bit of freedom on the road, yeah? No boss staring at you all day.
well, he's in a different office to me.
Oh, that's all right.
He comes round and shouts at me every day or so.
That's brilliant. Well, I mean, if there's anything else you want to say for me, I don't think I've got more questions really, apart from I didn't realise how an important thing it was, covering all the areas of health. It's good, fantastic.
I guess the only other thing we have got as part of Health Information Week, which we mentioned earlier, we have got a couple of events coming up this week, obviously talking to yourselves today.
Great.
But then tomorrow as well, there's Good Mood Food Cafe runs.
Good Mood Food Cafe, right. What, will that be like space cakes and stuff like that? Will they
I'm not sure, I don't think so. But an organisation called Little Sprouts work at Billingham Community Centre every Tuesday, and they support people with mental health conditions and things like that. But that's a really good kind of setup they've got there, just social support.
And anybody welcome kind of thing? Anybody?
Totally, yeah.
Brilliant.
And we'll be doing
good food as well.
Is it really?
Yeah.
No, I mean, obviously, when you eat good food, it does put you in a better mood. I love my food. I do. I'm eating a bit too much of it at the moment, though.
So we'll be doing a stall there as part of Health Information Week, kind of promoting what we're doing. But on Tuesday, that's at the Billingham Community Centre.
Brilliant. And all really good nosh and everything as well there.
Yeah, it's all good food, and it's pretty cheap as well, I think.
It's very
Is it?
reasonable. It's right opposite our offices.
All right. There you go.
And then Wednesday we've also got an event in Hartlepool. If anyone's from over that way, Cafe 177, that'll be between 10 a.m. till 2 p.m. And then this Friday we'll be in Central Stockton Library as well, from 10 a.m. till midday. Just doing the stall. But what we are trying to push through it is there's actually a hashtag on Twitter, so we're going to be doing a bit of social media as well.
Right.
And that's hashtag HIW 2016, but we're quite keen as part of Health Information Week to get other services information out there about health, so whether it's about awareness of health conditions and where to get support, or if there's any organisations who are offering support to people that want it shared, we're more than happy to kind of push that if they've got any leaflets that they want us to take to our stalls, or if any digital kind of online stuff we can share, we're more than happy to as well. So
the plot thickens.
Hopefully, if people have got stuff to share, let us know and we'll do our best. So.
Hey, well, I tell you, I'm absolutely enthralled. That's brilliant. So that's Andrew and Nathan, isn't it?
That's right, yeah.
Thank you so much for coming on. And listen, all you listeners, you've got all the information there. I hope you've written it down for all these different events and stuff. The website, go to any little inquiries, you know what to do. These guys look both very healthy, by the way, so why don't you take a leaf out of their book? No, hey, on a serious note, fantastic. I didn't realise it was going to be so interesting. Thanks a lot. Much obliged. And if there's anything you ever need to come on again and get out there, don't hesitate to ring us up and we'll make a slot for you.
Thank you very
much. That would be
much.
brilliant because, we like doing this kind of thing.